Motion sickness, a common ailment, arises from a fundamental conflict within our sensory systems. Our brain receives conflicting messages from the inner ear, eyes, and sensory receptors in our skin, muscles, and joints. This sensory mismatch creates a sense of confusion that the body interprets as a threat. Imagine sailing on a turbulent sea. Your inner ear senses the rocking motion while your eyes struggle to focus on a fixed point. This disparity between what your eyes see and what your inner ear perceives triggers a cascade of physiological responses. Our bodies have evolved to protect us from toxins. When the brain receives conflicting sensory information, it interprets it as a sign of poisoning. This triggers a defensive mechanism, nausea and vomiting, to expel the perceived toxin. Motion sickness, therefore, is not a sign of weakness. It is a testament to our body's remarkable ability to protect us, even if it sometimes means reacting to a false alarm. The symptoms of motion sickness are varied and often start subtly. Initially, one might experience a mild feeling of uneasiness or discomfort accompanied by a headache. As the sensory conflict persists, more pronounced symptoms emerge. Nausea, often described as a queasy feeling in the stomach, is a hallmark of motion sickness. This can escalate to vomiting, the body's attempt to rid itself of the perceived poison. Dizziness, a feeling of lightheadedness or unsteadiness, is another common symptom, reflecting the inner ear's struggle to maintain balance. Excessive sweating, paleness, and increased salivation are also frequently observed. These are autonomic responses triggered by the body's fight-or-flight mechanism, activated in response to the perceived threat. While these symptoms are generally harmless and subside once the motion stops, they can be incredibly unpleasant and disruptive. Certain factors can increase the likelihood of experiencing motion sickness. Children between the ages of 2 and 12 are particularly susceptible, as their sensory systems are still developing. Hormonal changes during pregnancy can also heighten sensitivity. The type and intensity of motion play a significant role. Unpredictable or irregular movements, such as those experienced on a turbulent flight or a winding road, are more likely to trigger symptoms. Interestingly, individuals can develop motion sickness in specific situations. For instance, someone prone to seasickness may not experience any discomfort while traveling in a car. Individual susceptibility varies greatly. Some individuals are naturally more sensitive to motion, while others develop tolerance with repeated exposure. Factors such as fatigue, stress, and anxiety can also lower the threshold for motion sickness. Fortunately, there are several strategies to manage and prevent motion sickness. One effective approach is to minimize sensory conflict. Choose a seat where motion is minimized, such as the front seat of a car or a window seat on a plane. Focusing on the horizon or a distant stationary object can help stabilize your vision and reduce sensory mismatch. Avoid reading or using electronic devices, as these activities can exacerbate symptoms. Over-the-counter medications such as antihistamines can be helpful in preventing and reducing symptoms. These work by blocking the transmission of nerve impulses between the inner ear and the vomiting center in the brain. For some, behavioral therapies, like desensitization, prove beneficial. This involves gradual exposure to motion stimuli, helping the brain adapt and reduce sensitivity over time. By understanding the causes and triggers of motion sickness and employing these practical strategies, individuals can navigate the world with greater comfort and ease.